time on canine hypothyroidism because, again, it's one of the most common endocrine disorders in the dog. As far as feline hypothyroidism, it's relatively rare. As far as naturally acquired primary hypothyroidism, there's only been one reported case of lymphocytic thyroiditis, and it had the same features as it did in the dog. The most common cause of hypothyroidism in cats is the veterinarian.
Oh, wow.
Because when you treat hyperthyroidism, which is very common in the cats, sometimes the treatments can, you know, if it's a tumor in there, what do? You take it out. And if the other thyroid lobule is not working, what are you going to get? Hypothyroidism. Also, use various drugs you use to treat for hyperthyroidism, and they can interfere with normal thyroid function. So that's the iatrogenic is the most common cause. And what's easier to treat though? Too much hormone or too little hormone? Too little. So sometimes you basically you get rid of the thyroid and then you just give thyroid supplementation for the rest of that animal's life. And so beasts can die from tumor invasion and all that kind of thing. Okay? As far as secondary and tertiary forms of hypothyroidism, they've not really been documented in the cat. Again, it doesn't mean they don't exist, but they've just not got any good reported cases of it. Okay, as far as the congenital primary hypothyroidism causing disproportionate dwarfism, it's recognized more frequently in the cat than any other kind. In other words, the most common cause of hypothyroidism in the cats, other than us, is cretinism. Okay, they have that much more common than they do acquired. Okay, and basically it's usually related to iodine uptake problems and thyroid dysgenesis, in other words, it doesn't develop properly. And goiter, something you're going to see is this because it's not functional production, it just sits there. And there is a family of Abyssinian cats, and if you want to get a breed of cat that has a lot of congenital disorders, what you're most likely going to get? Abyssinian or Persian. Okay, so the Abyssinian has congenital hypothyroidism has been documented very closely. And since you don't have a bunch of documented cases, what does that mean you can't establish? You can't establish the signalment. And so they don't really have one yet. The clinical signs, basically, if you have adult onset hypothyroidism, you're going to see lethargy, inaptitude, obesity, skin disorders, and this type of thing like you do with the dog. As far as the signs in congenital hypothyroidism, they're very similar to those in the dog. Again, the infected kitten may appear normal at birth, but you get a decrease in growth rate, usually by 6 to 8 weeks of age, and then you're going to see disproportionate dwarfism, get blocky heads and all this type of thing. This is just showing you the clinical manifestations, and you look, they're just almost identical to what we see with the dog. So that means you don't have to memorize everything like that. You know what happens in one, that's what happens in the other, right? Now, as far as, pardon me, the congenital, again, some of the things you see in other species. There's nothing unique as far as clinical signs between the different species. Okay, this is a hypothyroid cat on the left there. It's a 16-month-old cat, short-haired, domestic short-haired cat. You see how unkempt the hair looks? Very often in cats with endocrine disorders, instead of getting that nice alopecia, they get a raggedy haircut. Because what do cats spend a lot of their time doing? Grooming. And one of the problems is when they start to groom, and they can lick out portions of the hair. And it gets real rough, you know, patchy, this type of thing. Now, in time, they may lose all the hair like a dog does. Okay, if you look at that thing that's on the right there, this is a 9-month-old domestic short-haired cat that had delayed eruption of its permanent dentition. See, those are small teeth. It doesn't have, the molars and things haven't come in. So this thing, this animal has some difficulty eating and stuff? Yes. Okay, they also can get signs such as a severe head tilt. That cat's not looking back at somebody. That's the way it held its head all the time. Okay, you can also get keratitis ossica, which is, see all the inflammation and the pus and stuff in the eye there? That's very common. You can see that with dogs also. This is shown with the cat. The dogs don't often have the head tilt as much as the cats do. This is exophthalmos. I couldn't get a cat. There's no good exophthalmos, so you can see the humans. Bug-eyed appearance type thing. As far as laboratory findings, again, you may see very little as far as clinical path is concerned, other than low plasma T4 and T3 levels. Again, low T4 levels are most often caused by euthyroid 6 syndrome, or some other non-thyroidal illness, so we want to look at free T4 is a little more indicative of problems with this. You're going to get the hypercholesterolemia, the normal state, normal chromic, non-regenerative anemia, everything we saw that we saw in the dog. Okay, so that made it easier to remember, right? Okay. Occasionally, you can see hypercholesterolemia in iatrogenic and congenital hypothyroidism, but we don't know. We know we see hypothyroid, we see hypercholesterolism and everything like that, but some animals, some cats won't exhibit it. But generally, by the time we see them, they're exhibiting it because we usually see after it's been going on for a while. But by chance, you have a very conscientious client and they bring an animal in very quickly, you may not see problems with that. Diagnosis, combination of history, clinical signs, physical exam, your baseline serum thyroid hormone concentrations, and if indicated, an exogenous TSH or TRH response test. Again, the endogenous TSH assay may work in cats, but the incidence, how do you verify whether or not a test is accurate? What do you have to have? Control. You gotta have a lot of R number in there, don't you? You gotta have a lot N numbers and everything. You gotta have a lot of cases. We don't have enough cases in cats to verify. It probably does work all right, but we can't definitively say that. So if you can get a hold of some TSH and give it to it, it gives you a good diagnosis. Generally by the clinical signs, and if they have a low baseline free T4. But the problem is a lot of these times cats don't read the book again. They may have severe hypothyroidism and their hormone levels are low normal. So again, it's a little hard as far as cats are concerned. Okay? But again, endogenous TSH may actually be proven if we can get enough N number on there to say, yep, it does show this. Then it probably will work. I say it probably works, but we can't definitively say that. Treatment, your synthetic T4 is initial thyroid hormone of choice. It's like it is as far as the dog is concerned. The goal basically, again, is to get resolution of the clinical signs without getting too much thyroid hormone and causing signs of hyperthyroidism. So basically, the lowest dose possible to get rid of the clinical signs is what we're looking for. So what you should do, you should start your therapy, and then about 4 weeks. You don't want to measure it quite as quickly in a cat as you do in a dog. Dog, you want to look at usually 2 weeks. Cat, about 4 weeks. Bring it back in and reevaluate and adjust your dosage. Then, if the clinical signs are still there, what do you think you're going to have to do with your dosage? Increase it. If they're gone away, then you may leave it alone, or if you're starting to see some hyperactivity or something like that, then you decrease it. Okay? But the overall goal is to try to get serum T4 levels to stay at 1.5 to 3 micrograms per deciliter. Sounds easy, but it's not that easy as far as cat's concerned. Prognosis, again, depends upon the underlying cause and how old the animal was that clinical signs developed. The younger the animal, the worse the prognosis is. And with appropriate therapy, the life expectancy of an adult normal cat with primary hypothyroidism should be normal, as long as you can get your thyroid hormone supplementation straight. Ones with kittens with cretinism, again, is guarded to poor. Again, depends upon how severe the deformation of the skeletal lesions, the brain, all that stuff is, just like it was in the puppy. Equine and ruminant hypothyroidism. Well, the hyperplastic goiter in neonates is the most common thyroid disorder in the horse and small ruminant. Now that doesn't mean it's actually more common, but that's the one we see most often clinically. Okay? It's caused basically by insufficient or excessive iodine in the diet of the mother during gestation. And the most common cause is generally ingestion by the dam during pregnancy of excess iodine or plant goitrogens. Okay? And the placenta is permeable to iodine and plant goitrogens, but it's impermeable to the mother's T4, T3 levels. So in other words, those goitrogens go in there and they stimulate that fetal thyroid, but the mother can't control it because her T3 and T4 levels can't get in there and cause it to lower. And so that's why it just keeps going and everything. As far as the manifestations in the newborn, you may have a very hypometabolic state, which will occur concurrent with your thyroid hormone inadequacy or developmental lesions. And you can see, normal, actually you can sometimes see normal thyroid hormone levels in these animals when they're born, but they still have this problem when they were developing, and so you're going to have long-lasting problems as far as this is concerned. And basically, if the animal still has the clinical signs and your hormone levels appear to be normal, that means that the development that the hormone level is supposed to control wasn't controlling it, so you've already got the lesions. Everybody follow that? In other words, the hormone may be perfectly normal, but that animal is not normal because it had problems before that thyroid was able to recover enough to do anything. Okay? There's no specific breed or sex predilection for neonatal hypothyroidism or equine ruminant. And again, it depends as far as the clinical signs. Again, if the calf is abnormal and dies soon after birth, are we likely to see that calf? No. Same way with the foal, more likely depending upon who the owner is, but probably not going to see much of them. But basically, if there's insufficient iodine, the animals will be born dead or weak with goiter and little or no hair. If there's excessive iodine, foals are born weak. They can have goiter and limb abnormalities. Excessive iodine usually gives you more limb abnormalities than decreased iodine does. They can have incoordination, poor suckling and riding reflexes, and if they can't suckle, what will usually happen to them? They'll die. And this is associated with hypomyelination and lesions of the central nervous system that occurred from that iodine. Hypothermia, because of the lower metabolic rate.
What's a riding reflex?
Riding reflex is, well, if you stumble, can you catch yourself?
Mm-hmm.
Or if you're down, can you get up? That's a riding reflex. In other words, you don't have to think about this, I gotta stop myself from stumbling. Your leg automatically goes out there, my mind doesn't anymore, but anyway, your leg goes out there to keep you from falling. That's the
Spatial
riding
awareness?
Huh?
Like spatial awareness?
Mm-hmm. Basically. Yeah. Now, some animals can be born with no apparent signs, but after a few weeks, you start to see skeletal lesions and this type of thing, particularly in the tarsal area. This type of thing. Okay, this is a foal right here, had neonatal hypothyroidism. And what do you think? Do you think he's standing up by himself, or is that person holding him up? That person's holding him up. What about the muscles? And what are the tendons doing? Contraction of the tendons, which you're seeing, particularly in those front legs. See how like that. And so that's what you can see with this. And the fully extended carpal angle was about 150 degrees, and it should be 180 degrees. You can see it couldn't do that. You see here's a severe one. You can see what about those carpal bones up there? Are they supposed to do that? No. And you think they're going to get over this? No. And basically a joint collapse, as far as this is concerned. Here's a tarsal joint radiographs from a foal that had neonatal hypothyroidism. And how many, when you're doing a joint, how many of the lines are you supposed to see in these joints? You're supposed to see one at the epiphyseal junction, right? What have we got in some of these guys? Some multiple. And that means the epiphyses is not properly, not ossifying completely and everything. And it's all throughout this particular joint. So what's going to happen to that joint probably? It'll collapse. You can end up with breakage and everything else. Okay, this is thyroid tissue from a 2-day-old male quarter horse, presented with contracted flexor tendons in all limbs and prognathism. What's prognathism? Yeah, protrusion of the jaw in here. Radiographic examination of metacarpal bone showed incomplete ossification. This is histopathological exam of the thyroid. What do you see in that thyroid right there? You see any nice follicles, or is there a lot of hyperplastic epithelium and all that kind of thing in there?
Sure.
In other words, even at this age, you should see colloid and follicles. And do you see much in here? Is it just a lot of epithelial hyperplasia and stuff? It's epithelial hyperplasia. You think it's functional? No. If you're not making colloid, are you functional? No. And this would be a hyperplastic enlarged goiter type thing, where you have goiter as far as a goiterogenic goiter. That's big follicles aren't doing anything. Okay, here is a lamb that exhibited congenital goiter. See the big bulge over here? And that one on the left. And anything wrong with that one at the top right there? Supposed to have a big bulge like that? What about hair?
It's supposed to be long.
Doesn't have any hair or anything else, does it? And this was ingestion of kale and rape, which are your brassica species, by the ewes. And you can look down at the bottom, you can see those two lambs down there. Goiter is worse than the one on the top than it is on the bottom, but severe. And needless to say, they may have lived, ones on the bottom may have lived for a few minutes, one on the top was born dead. Again, here's goiter in a human. That's what I'm trying to show you. This stuff does have application to human medicine, okay? As far as laboratory findings, you may exhibit no clinical pathological abnormalities, and you may not actually get any samples from them. If they're born dead, can you get samples? Can you get blood samples from a dead animal very easily?
Not
No. No. Okay. Your plasma T4 and T3, and those that do survive, your plasma T4 and T3 levels may be normal to low. And basically, total T4 and T3 and T4 levels in normal newborn foals are about 10 times higher than they are in the adult horse. So you got to be careful if you're comparing your results to normal ranges in the adult. It's going to look like, well, this shouldn't be anything wrong with this, but they're supposed to be much higher in those young animals. Okay? After about the first few months, 3 to 4 months, they'll go back to be the same range as adults are. Okay? So suspected samples from suspected foals, if possible, you should run them with age match controls. In other words, if you've got some normal foal on your farm or something, or the owner does, then ask them to, you go out there, you take a sample from the normal foal and from the affected foal and compare them. That way you got comparison. Diagnosis, well, combination of history, clinical signs, physical findings. If you've got something that looks like that, you don't think you're going to have trouble getting a diagnosis? All that goiter under there. Also, baseline serum thyroid hormone concentrations, and if indicated, you may do a TSH response test if you've got the stuff available to do it. The TSH stimulation test is reported to cause a 2-fold increase in T3 at 1 to 3 hours post-administration in normal 1-day-old foals. And basically, the increase in T4 is inconsistent, so T3 is the best one to measure. So if you do have that TSH and use that synthetic human TSH and give it to the animal and you get no response, what does it tell you that foal has? Hypothyroidism. In other words, these would be done in animals which don't quite have the severity of the clinical signs that you saw in the pictures. Okay? And your clinical signs can be due to thyroid imbalance at some point during gestation, which may have corrected itself. In other words, they may have been affected with it, and when they're born, they're not showing the clinical sign. Now, as they mature, then you'll start seeing compromise of various functions and stuff. Okay? Treatment? Well, nutritional evaluation, because if you're given, they've got this pasture out there that's full of these brassical species or this type of thing, what do you want to tell the owner not to do? Let their mares and then get out there, right, or their cows and stuff, okay? Thyroxine supplementation can help if they're not so severe. If they've got a lot of severe skeletal deformities, what's the best thing to do? Recommend what? Euthanasia. But if it's not that severe and you think by supplementing the thyroid hormone, you may be able to overcome the problems, you can do that. And also client education. Tell them why this happened. You know, what's going to happen to this animal if it's severely affected, what it'll do further down the road. Okay? And prognosis, if they got all those skeletal deformities, what do you think the prognosis is? Because what do they say? A horse is only as good as its what? Legs. And if they don't have that, then they're not going to be surviving. Now, the thing that's more common in feline as far as thyroid is hyperthyroidism. Alright, it's the most common endocrine disorder in cats. Okay? And it's usually caused by what we call multinodular adenomatous hyperplasia or functional adenomas. And rarely the thyroid, remember thyroid carcinomas in most species are non-functional. Sometimes about 5% of the ones in cats are functional, but a lot of them aren't also. But the main thing you see is the adenomas, which are functional. Okay? About 20% of hyperthyroid cats have a unilateral thyroid involvement, but 80% have bilateral. So, what would be one way I could look at an animal and determine is this thyroid problem because I've got too much TSH? What would I look at in my thyroid gland most of the time? If it's too much TSH, are there going to be unilateral involvement or bilateral? Bilateral, but unfortunately you can't do that in cats because they can still have a primary thyroid problem and it's bilateral. They can have a primary adrenal problem, it's bilateral. So you can't use that to differentiate between secondary and primary very often in the cat. Okay. About 5% of cats, your thyroid mass can be in an ectopic location. In other words, your thyroid may look perfectly normal, but you've got this mass down here in the thoracic inlet. And you do a aspirate of that mass or a biopsy of that mass and find out it's thyroid tissue. And so you take that out, and usually the animal's going to be fine from that. Here's this bilateral thyroid enlargement right there at the top. And you can see a thyroid carcinoma down there at the bottom. It looks a lot worse, doesn't it? And that particular one was not functional down there. One of the problems with carcinomas, what does that mean they'll do? Metastasize. These are some very important things around this area, isn't it? Okay. As far as assemblement, hyperthyroid usually develops in your elderly cats from 9 to 22 years. I know that's a wide age span. Now, does that mean if a 5-year-old cat comes in and you know it's got hyperthyroidism, it can't have it?
You can.
Because they don't read the book, right? So, in other words, when we're talking about age predilection, it doesn't mean other ages can't get the things, but it's not as likely, okay? Only about 5% of your hypothyroid cats get it before 10 years of age. And what's going to be the one you get in your clinic?
That one.
Or that 5%, right?
Mm-hmm.
Appears to be no breed or sex predisposition, but domestic short hair and long hair seem to be most frequently affected breeds. But what's the most common breed? Clothes, so that may have something to do with that, right? As far as the clinical signs, you can often palpate the thyroid mass in about 90% of the cats with hyperthyroidism. It's a little more difficult in other species to do that. But you gotta be careful. Remember, we got lymph nodes up here too, and we can have lymphoma that we're palpating instead of thyroid. Okay. Also, you can get some salivary gland enlargements and things. So you just be careful you're getting the right thing. Most common clinical signs, if you increase the metabolism, what's that going to do to the weight?